Your COPD patient suddenly becomes confused and increasingly drowsy. What should the nurse do first? Don't answer too quickly. Think like a nurse. Is this a normal finding, or could your patient be deteriorating? The answer is assess. A sudden change in mental status is an acute change. Start with your ABCs: airway, breathing, and circulation. Assess the patient's respiratory rate, work of breathing, breath sounds, oxygen saturation, and level of consciousness. So, why can a COPD patient deteriorate like this? COPD causes persistent airflow limitation. The airways can become narrowed and inflamed while excess mucus further obstructs airflow. In emphysema, damage to the alveoli reduces elastic recoil and makes it harder to move air. This can lead to air trapping and impaired gas exchange. Now, go back to our patient. If they're suddenly confused and increasingly drowsy, don't simply say, "That's COPD." Treat it as a warning sign and reassess. Remember, pulse oximetry tells you about oxygen saturation, but it doesn't directly tell you how well the patient is ventilating or if they're retaining carbon dioxide. Depending on the patient's condition and clinical orders, blood gas testing may help evaluate ventilation and acid-base status. Next, think priorities. Support the airway and breathing, position them to optimize ventilation, monitor respiratory status, and administer oxygen according to the prescribed target. For patients at risk for hypercapnic respiratory failure, a common target range is 88 to 92%, but don't treat that number in isolation. Consider the clinical condition and protocol guidance. Administer prescribed therapies like short-acting bronchodilators when indicated, and reassess the patient's response. If the patient continues to deteriorate, especially with worsening mental status or signs of respiratory failure, escalate care immediately. Now, let's talk about the NCLEX traps. Trap number 1. Assuming every COPD patient needs the same oxygen flow rate. They don't. Oxygen therapy should be individualized and titrated. Trap number 2. Treating the monitor instead of the patient. An oxygen saturation number is important, but you also need to assess respiratory effort, mental status, breath sounds, and the patient's overall condition. Trap number 3. Withholding oxygen due to fear of the hypoxic drive. You must never withhold life-saving oxygen from a patient in acute respiratory distress.